Post-operative pain. How do you effectively manage pain while avoiding complications like opioid dependence, respiratory depression, or inadequate pain relief? I'll talk through pain control in surgical patients. So why pain control matters? There's going to be consequences of uncontrolled pain, and this includes delayed recovery, increased risk of complications which include atelectasis, DVT, or chronic pain, poor patient satisfaction, and psychological distress. Effective pain control leads to the following: faster recovery and mobility, reduced complications, improved surgical outcomes, and better patient experience. So the principles of pain management includes the following. Number 1, multimodal analgesia, using multiple agents with different mechanisms to minimize opioid use. Number 2, individualized approach. Consider the patient's age, comorbidities, type of surgery, and pain tolerance when actually choosing what you're giving. Number 3, stepwise escalation. Start with the least invasive methods and then progress and escalate as needed. What are the pain control options? Well, there are going to be pharmacological and non-pharmacological. Non-pharmacological methods include ice packs, positioning and splinting, physical therapy and early ambulation, and psychological support. Pharmacological methods include other non-opioid drugs, which we can start with acetaminophen, which is an anti-inflammatory. It could be considered as a first line for mild to moderate pain, although it does have liver toxicity, so be careful with those patients who have liver issues. The next one is going to be NSAIDs. They're also anti-inflammatory and analgesic. Caution on patients with renal impairment, GI bleeding, and platelet dysfunction. This is often held with major GI or renal surgeries. And after the two, then we actually go to our opioids. Commonly used are morphine, hydromorphone, fentanyl, and oxycodone. These are used for moderate to severe pain, and they do have side effects. Especially for older people, respiratory depression is one of them, and you have to make sure you monitor them because they can actually stop breathing, in which they may need naloxone. Complications include nausea and vomiting, constipation, that's why you want to make sure they're fully hydrated, and they may need stool softeners to go with it. And for people who are on chronic pain medications, there is a risk of dependence. This may either be given through IV or oral once they're tolerating a diet. Right now, there's also transdermal, which can be utilized for outpatient management. After opioids, don't forget about regional anesthesia. Local nerve blocks, such as tap blocks, femoral nerve blocks, is going to be a very important adjunct. Other considerations are epidural anesthesia, excellent for abdominal or orthopedic surgeries. This requires anesthesia team involvement. However, it significantly decreases your opioid use, so consider this for patients who are going to have major surgery that may require a tremendous amount of pain control. So, what are the things that we have to consider? Elderly patients have higher sensitivity to opioids. Start low, go slow, and emphasize non-opioid analgesic strategies. Don't forget about people with renal or hepatic impairment. There's going to be Tylenol toxicity and going to be NSAID toxicity for each organ. Modify your doses for your NSAIDs, opioids, and acetaminophen as needed. For people who do have a substance history, consider a higher baseline for tolerance, and you may have to coordinate with pain or addiction specialists. Remember, there is the ARIS protocol, or enhanced recovery after surgery. This requires multimodal analgesia as a standard and early ambulation and limited opioid use so that they can actually recover faster. What are the common pitfalls and how to avoid them? Over-reliance on opioids, which leads to side effects and longer hospital stay. Underdosing of your analgesia delays recovery and increased complications, especially with pain management. Neglecting regional techniques actually equals to a missed opportunity for excellent pain control. Forgetting constipation prevention. Always prescribe bowel regimen with opioids. So, to summarize, always consider multimodal analgesia as your cornerstone. Tailor your approach to each individual. Balance efficacy with safety. Involve anesthesia or pain specialist for complex cases. And prevent opioid-related complications. If you guys liked the video, please click the like and subscribe button. And if you guys have any questions, please type it in the chat and then check out the videos here so that you can actually learn a lot more. And I'll see you guys next time.